incorporated. So I already closed the door to ensure your privacy, ma'am. So I will just, for verification, may I know your name, please?
Darmi Del Rosario,
Okay, how about your birthday?
July 15, 1981.
So how would you like me to call you?
Darmi.
Okay, Darmi, today I will be performing an eye assessment to assess the condition of your eyesight, as well as whether there are any specific location or angle where you have abnormalities in your eyes. So during the assessment, I might need you to stand, sit, or read something. And I will also be shining a light into your eyes. So will that be okay with you?
Yes, ma'am.
Okay, so do you have any questions or clarifications before we start?
No, ma'am.
Okay, so rest assured that all the information gathered in this assessment will all be kept confidential. So before we start, may I ask if you're comfortable with your seat?
Yes, ma'am.
How about the temperature? Do you want me to adjust the temperature?
No, ma'am.
Okay. If you feel uneasy or uncomfortable, feel free to address it to me, okay?
Yes, ma'am.
Okay, so I am just going to ask some questions regarding your health concern, okay? So can you describe to me any recent visual difficulties or changes in your vision?
Parang malabo na yung mga mata ko gradually.
Okay, so your eyes are gradually getting blurry. So do you see spots or floaters in front of your eyes?
No, ma'am.
Okay, so how about blind spots? Do you experience any blind spots?
No.
Okay, so do you have any eye pain or itching?
No, ma'am.
How about any redness or swelling in your eyes?
No, ma'am.
Okay, so have you ever had problems with your eyes before?
No, ma'am.
Have you ever had surgery or any medications or treatments related to your eyes?
No, ma'am.
Okay, so do you have a prescription for corrective lenses like glasses or contact lenses?
No.
Okay. So is there a history of eye problems or vision loss in your family?
No, ma'am.
Okay, so has your vision loss affected your ability to care for yourself or to your work?
Sometimes parang nahihirapan ng makabasa lalo na pag malayo o maliliit yung letra, but it doesn't really bother me.
Okay, so what do you usually do when you find it hard reading?
Ganyan lang yung ano.
Oh, so you're squinting your eyes.
Yes, ma'am.
Okay. So can you describe to me what you usually eat on a daily basis?
Sa umaga, mga itlog, scrambled eggs. Sa tanghali, mga gulay, sabaw na gulay. Sa hapunan, mga sabaw na isda at karne.
Okay, so do you take any vitamins or supplements?
Yes, ma'am.
So what vitamins or supplements do you take?
Vitamin C and vitamin E.
Okay. So now I am going to proceed to the eye assessment.
Yes.
So now I will be assessing first your visual acuity, which is the degree of detail an eye can discern in an image from a specific distance. So for this assessment, we will be using a Snellen chart. So what I need you to do is to distance yourself 20 feet away from the Snellen chart. So can you please stand right here? Okay, so that's our Snellen chart over there. So I will be asking you to read the Snellen chart from top to bottom until the last line you can read.
Yes, ma'am.
Okay, so using this cardboard, I need you to read through your right eye like this, covering your left eye. Then afterwards, your left eye, covering your right eye. And then afterwards, both your eyes. Okay?
Yes, ma'am.
Okay, so let's start with your right eye.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P.
Okay, let's proceed with your left eye.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D.
Okay, so let me have the cardboard, please, and read the Snellen chart again using your both eyes.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P.
Okay, so you may sit down. Okay, so now I will be performing a vision test. So what I need you to do is to tell me how many fingers I am raising. Okay? Okay. 2. Okay, how about this?
3,
How about this?
1.
Okay, so now I want you to tell me the direction where my finger is pointing. okay?
Yes, ma'am. About
How about this?
left,
Okay, this one.
down,
Okay, this one.
right.
Okay, so now I am going to shine a light in your eyes, and what I want you to do is to tell me if you see the light, okay?
Yes, ma'am.
Do you see the light?
Yes, ma'am.
How about this?
Yes, ma'am.
Okay, how about this?
Yes, ma'am.
How about this?
Yes, ma'am.
So can you tell me what direction is the light coming from?
Left.
Okay. So your right eye is 20/30, which is near normal vision. Your left eye is 20/25, is normal vision, and both your eyes are 20/30, which is also considered to be near normal vision. Okay. So now I am going to assess your visual field, which is the area in which objects can be seen in the peripheral or side vision with the eyes focused on a central point.
Yes, ma'am.
Okay, so I will be sitting 2 feet away from you. So what I need you to do is to look straight into my eyes, okay?
Okay, ma'am.
And tell me if you see my fingers entering your visual field.
Yes,
So you
ma'am.
can just say the word okay if you see it, okay?
Yes, ma'am.
Okay.
Okay. Okay. Okay. Okay. Okay. Okay.
Okay. So I will do the wiggling again and tell me if you see my fingers entering your visual field, okay? So,
Okay. 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 Okay.
okay, on the other side.
Okay. 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 Okay.
Okay. Okay, so the inferior degree or the downward degree is 70 degrees. The superior or the upward degree is 50 degrees. And the temporal degree is 90 degrees and the nasal degree is 60 degrees, which is all normal. Okay, so now I am going to inspect your eyes, okay? So I can observe that your eyes are aligned and symmetrical. The hair of your eyebrows are evenly distributed and aligned. So can you raise your eyebrows for me like that? Okay, thank you. And down like this. Okay, so there are no signs of any lesions in your eyebrows. So I can also observe that your eyelashes are both evenly distributed and the direction of your eyelashes is curved outward, which is normal. I can see that the upper lid margin is between the upper margin of the iris and upper margin of the pupil, which is also normal. The lower lid margin rests on the lower border of the iris. So can you close your eyes for me? Okay, so it closes symmetrically. No discoloration, no swelling, and no signs of any lesions, which is also normal. Okay, so now I am going to assess your lacrimal gland and your lacrimal sac for swelling. So I am just going to palpate your lacrimal sac, okay?
Okay, ma'am.
Okay. Okay, so no indentation found, meaning there is no presence of edema and there is also no swelling. Okay?
Okay, ma'am.
So now I am going to assess the sclera and bulbar conjunctiva. Okay, so can you please look up? And I am just going to depress your lower lid, okay?
Yes, ma'am.
Okay, so I can observe that the bulbar conjunctiva is clear, moist, and smooth, and the sclera is white in color, which is normal. Okay, so can you please look down with your eyes slightly open like this? And I am just going to revert your eyelids, okay?
Yes, ma'am.
Okay, on the other side. Okay, so I can observe that the palpebral conjunctiva does not have any swelling and trauma. So now I am going to inspect your iris and pupil. Okay, just look straight into my eyes. Okay, so I can see that the iris is round, flat, and evenly colored. The pupil is round in shape and the pupil size is the same. So no opacity, and I observed that the pupil is at 4 millimeters, which is normal. Okay. So now I am going to inspect for your cornea and lens. So I will be using a pen light to check for your cornea and lenses. Okay. So I want you to look straight ahead. Okay.
Yes, ma'am.
And the other side. Okay, so the cornea is transparent with no opacities. The surface is moist and smooth, and the lens is free from opacities, which is normal. Okay, so now I will assess for your pupil's direct and consensual reaction to light. So I am just going to turn off the light, okay?
Okay, ma'am.
Okay. So I am going to shine a pen light again into your eyes. So just look into that object in the distance, okay? Okay, so now I am going to shine a light obliquely into your eyes, okay?
Yeah.
Okay, so I observed that there is a constriction in your right eye, which is a normal findings for direct pupillary response. And for the consensual reaction, while I shone light into your eye, the opposite eye also constricted, which is normal. Okay?
Yes, ma'am.
Okay, so now I will be assessing for your pupil's reaction to accommodation. So what I need you to do is to focus your eye at the tip of the pen light, and then afterwards look at the wall on my back, okay?
Yes, ma'am.
Okay, so look at the pen, then at my back, then at the pen again, then at the back, then at the pen again. Okay, so I observed that the pupils constricted, which is normal. Okay? Okay, so now I will be performing the Hirschberg test. So I am going to shine a light in your eyes to look for the reflection of it in your cornea. So what I want you to do is to look straight. Okay?
Okay, ma'am.
Okay. Okay. So I observed that the light reflects symmetrically in the center of both of your pupils. So there is also a direct and consensual reaction, which is normal. Okay, so now I will be performing the cardinal field of gaze test. So this is to assess your extraocular movement. Okay.
Yes, ma'am.
Okay, so I am going to stand 2 feet away from you. Okay, so what I need you to do is to follow the tip of my pen light without moving your neck. So you're just going to follow it using your eyes only, okay?
Yes, ma'am.
Okay. Okay, we'll do it again, okay? Okay, so I observe that your eyes move in a smooth and coordinated motion in all directions. And I also observe that the sclera is clear and white while your eyes move up and down, which is also normal. Okay? So now I am going to test for convergence. So what I want you to do is to look at the tip of my pen, okay? And follow the movement of it, okay?
Yes, ma'am.
Okay. Let's do it again, okay? Okay, so I observe that your eyes converge whenever I move closer the pen tip, which is normal. Okay, so now I am going to summarize everything, starting with your visual acuity when you were reading the Snellen chart. So your right eye is 20/30, which is near normal vision. Your left eye is 20/25, which is the normal vision. And both your eyes are 20/30, which is also considered to be near normal vision. So for the visual field, remember when I was wiggling my fingers. So the inferior degree or the downward degree of your visual field is 70 degrees. The superior and upward degree is 50 degrees. The temporal degree is 90 degrees. And the nasal degree is 60 degrees, which are all normal. Okay? So I also observed that your eyes are aligned and symmetrical. Your eyebrows and eyelashes are evenly distributed. eyelids are intact and lids close symmetrically. Okay? No discoloration and any signs of lesions found in your eyelids. I also observed that you have a normal blinking. Okay? So there are also no signs of swelling in your lacrimal glands. And the bulbar conjunctiva is clear, moist, and smooth, and the sclera is white in color. So the pupil is round in shape, and the pupil size is the same, which is 4 millimeters. So the cornea is transparent, and the lens are free from any opacities, which is also a good thing. So the pupil's direct and consensual reaction to light is normal. The pupil's reaction to accommodation and convergence is also normal. And your eyes move in a smooth and coordinated motion in all directions, which is also a good thing. Okay, so all in all, the results of this assessment are all normal except for your visual acuity. So specifically your right eye and both your eyes, which is 20/30. So I suggest for you to see an ophthalmologist, or I can endorse to you our ophthalmologist to further assess your visual acuity, since it might be the reason for your visual difficulty that you have said earlier. Okay, so I also suggest to continue taking some vitamin C and E and omega-2 fatty acids, since they are helpful in our eyes' visual functions. So do you have any questions or clarifications before we end? Okay, so that's it for our assessment. We will just contact you if we have follow-up assessment. So thank you so much, Darmi, and have a good day.
Thank you.